Okay, let's dive right into this explainer. I'm putting on my systems engineer hat today to speak directly to you, the healthcare administrators. We are here to structurally fix the $100 billion leak in our medical payment programs. We're not going to talk about politics today, and we're definitely not focusing on isolated scandals. Instead, we're going to look closely at the actual architecture of Medicare and Medicaid. We need to treat these massive recurring financial losses for exactly what they are, a structural engineering problem that demands an engineering solution. So here's our blueprint for today. We're going to systematically cover 1. The structural engineering diagnosis, 2. The healthcare black box, 3. Engines of continuous improvement, 4. Unified inspection architecture, 5. Pilot costs versus savings, and finally 6. The 36-month implementation roadmap. All right, starting with Section 1, the structural engineering diagnosis. To actually fix this massive leak, we absolutely have to pivot our perspective. You see, when losses happen at a massive scale year after year, it's not a crime wave. It's unmanaged system variation. The system's complexity has simply grown way faster than its internal discipline. To put the sheer scale of this instability into perspective, Medicare and Medicaid move more than $1 trillion annually. At that scale, just a 1% error rate equals roughly $10 billion. $10 billion. That is literally the entire annual budget of a mid-sized state. And yet, from 2012 through 2022, combined improper payments hovered between $70 and $100 billion every single year. You know, this isn't an anomaly, it's normalized instability. The legendary engineer W. Edwards Deming really hit the nail on the head when he said, "A bad system will beat a good person every time." It's a great reminder that failure is actually a predictable outcome of poorly designed systems, not just individual malice. In fact, estimates suggest that as much as 85% of all improper payments are attributable to system errors, ambiguous coding rules, and process weaknesses, not deliberate fraud. If we just run around hunting for bad actors, we completely miss the underlying architectural flaws. Right now, we're stuck in this totally flawed reactive pay and chase loop. Money goes out the door, and we audit it months or even a full year later. By then, the errors have compounded, and trying to recover those funds is incredibly costly and difficult. It's a nightmare. We need to shift to a proactive, prepayment structural integrity model where anomalies are caught before a single dollar is ever distributed. Moving on to Section 2, the healthcare black box. Let's look at how aviation safety standards can directly improve our healthcare systems. Aviation handles incredible complexity with massive life-or-death stakes, yet they slashed fatal accident rates by 90% over 50 years. How did they do it? Through relentless, real-time data inspection. Enter Statistical Process Control, or SPC. Think of this as healthcare's equivalent of a flight data recorder, a black box to detect errors before the money even moves. Just as a plane's black box continuously logs operations to catch deviations instantly, SPC tracks claims in real time. It identifies exactly when billing variations cross the threshold of what we expect to be normal behavior. By mirroring these aviation safety protocols, we deploy 4 absolutely crucial steps. 1. Automatic data capture for all transactions. 2. Continuous monitoring of the billing process. 3. Immediate anomaly detection. And 4. If a threshold is crossed, the system automatically stops the improper payment instantly. It flags the deviation and forces a review right then and there. You don't have to chase the money because, well, the money never left the building in the first place. All right, Section 3, Engines of Continuous Improvement. Having a black box is pretty much useless if you don't have a structured way to actually fix the problems it uncovers, right? That structured procedural tool is the PDCA cycle. Plan, do, check, act. This functions as the living, breathing engine of our new architecture to systematically verify and integrate fixes. When an error is caught, you plan by identifying the risk. You do by implementing a focused workflow redesign. You check by measuring if the error rate actually dropped. And then you act by standardizing that fix across the whole system. This literally embeds correction into your daily operations, so the large, complex system essentially heals itself over time. But before we can act and apply that fix, we have to ask ourselves a vital question. How do you stop merely treating surface-level symptoms and actually pinpoint the underlying engineering flaw? I mean, if a hospital is billing incorrectly, throwing a new penalty at them doesn't really help if the actual root problem is a poorly written software interface causing cognitive overload for their billing staff. That's where we use the 5 whys approach. By repeatedly asking why, this structured analysis uncovers the deep root causes for improper payments, making sure our solutions actually hold up over time. If a claim is denied, you ask why. If it was a coding error, you ask why. If it was due to a mistraining update, you ask why again. You keep digging, asking why, until you find that true structural disconnect. This prevents us from blaming our frontline staff for what is actually a systemic training or software failure. Which brings us to Section 4, Unified Inspection Architecture. We have to outline the phases for migrating from our current, highly fragmented oversight to a unified military-grade inspection structure. In a military context, failure just isn't an option. So oversight is built in, it's independent, and it's layered. We need that exact same discipline right here. We must transition from these vulnerable, reactive silos to a unified, proactive, prepayment ecosystem. We are moving away from delayed post-payment audits where state and federal teams are just duplicating efforts or missing things entirely. The future state relies on real-time screening and centralized tracking. Corrective actions are kept open until we have objective evidence proving the problem is totally 100% solved. Let's look at Section 5, Pilot Costs versus Savings. As systems engineers, we deal in ROI and investment justification. Transformation takes resources, so let's break down the financial logic of shifting to this proactive architecture. Upgrading our data infrastructure and standing up a national claims analytics center could cost somewhere between $200 and $500 million annually in pilot program costs. Now, I know that sounds like a lot, but spending millions upfront is mathematically necessary to secure billions in long-term taxpayer savings. Even a modest 10% reduction in improper payments yields $7 to $20 billion in annual savings. Think about that. It pays for itself almost immediately. Compare this to traditional auditing, which is highly manual, involves lengthy investigations, and honestly only recovers about $1 for every 4 spent. Real-time statistical monitoring, on the other hand, delivers an incredible 1 to 10 recovery ratio. Because these automated alerts catch faults early, you are slashing the massive administrative waste and overhead of the old pay-and-chase model. Finally, Section 6, the 36-month implementation roadmap. Let's ground this theoretical blueprint into an actionable administrative reality. Look, you don't overhaul a trillion-dollar system overnight, but you absolutely can systematically implement it within 3 years. Here is exactly how you adopt these military-grade inspection frameworks over a deliberate 36-month timeline. You spend the first 6 months configuring the data foundation and establishing audits. Then you run Phase 2, a sentinel state pilot in high-risk categories for a full year. From month 19 to 24, you independently evaluate the data, proving the concept works. And finally, months 24 through 36, you scale those verified, successful systems nationally. It's controlled, it's logical, and most importantly, it's evidence-based. To conclude our explainer today, I want to leave you with this final provocative mandate. The billion-dollar leak is not an accident of nature, and it is not just the result of bad actors. The leak is structural. It happens because we designed it to happen, whether we realize it or not. So, knowing what we know now about aviation safety, statistical process control, and real-time oversight, what inspection architecture will you commit to building before the next budget cycle?